Good afternoon and welcome to the webinar entitled Change the World, Using Social Cause Marketing Strategies to Enhance Your Impact. I'm Debbie Thompson and delighted to be here with you this afternoon to talk about this important topic. And what's interesting to me is in the last few years, I have not heard in the nonprofit and community health circles that I travel in a lot of discussion about social cause marketing. It seemed to be pretty big at the end of the, last decade, 2007, 2008, 2009. There was a lot of people I saw that were trying to do social marketing programs and trying to do campaigns and things like that, but not so much in recent years, although there's a few notable campaigns out there. But what brought this whole topic to mind for me was the fact that I'm a licensed consultant for the Pennsylvania and the National Standards for Excellence, which is a ethics and accountability code for the nonprofit sector. And I'm actually very involved with the Pennsylvania Association of Nonprofits because I'm located in Pennsylvania. And that organization in recent years has done a lot of training around encouraging nonprofits to take a legitimate role in advocacy, and that L word that everybody hates, actually lobbying. And the difficulty is that a lot of people don't understand what the rules are and what the regulations are and kind of what the limits to lobbying are. And as we were talking about that, and as Pennsylvania and the National Standards Institute are rolling out what they call version 2.0 of the standards, which is the updated version of the standards for excellence, we've been talking a lot about, what those items are. So I thought, this is a good time to sort of bring this topic out again and talk about it. So here's what we're going to talk about. By the end of the session, hopefully you will have an understanding of the definition of social cause marketing and the role it can play in helping your organization achieve its vision and goals. And then think a little bit more strategically about how to target your outreach and education efforts to consumers and advocacy efforts to policymakers by using the social cause marketing model. And I'm going to talk about how to do both through the context of this talk. So the questions to ask yourself as we start down this journey is, first of all, does your organization implement strategies to educate and engage people to support your cause and benefit from your programs and services? Are you actively doing that and thinking about the decision-making process that people go through to engage? And then, are you embracing your role in educating legislators and policymakers to create the environment for systemic change? And many of the organizations that I know and have worked with actually do number one. They try to do number one. Many of them don't do it as well as they could or in a sophisticated manner as they could. And many of them don't do number two at all, even though the organizations like PANO and the National Standards Institute try to encourage them to do that. Now, what is social cause marketing? It's not social media, although social media can play a role in a campaign, and viral marketing, if you will, can play a role in a campaign and help people understand your cause in a way that wasn't possible without the technology that we have today. But it isn't just social media. There's a much broader definition to it. Now, here's the definition. Social cause marketing is a campaign. It's a series of activities that are comprised of intentional marketing and advocacy to achieve social engagement with the intent to influence a target market to change specific behaviors and then ultimately benefit society. So there's a broader goal there. And why is it important to you? Because most nonprofits, if not every nonprofit that ever existed, has a social cause that you're trying to influence or change. I have met hundreds of nonprofit leaders over the course of my career, and whether you're in a hospital or in a community-based nonprofit, or even in an economic development agency that is a 501c3 or even a 501c6 as part of your tax status, there's a cause that you're trying to make a difference in the world around. And this approach can help you develop some strategic thinking around that and a plan to help fund your intervention program that will deliver a social change outcome. And there are ways to measure it. So you should be thinking, broadly and about how to do it and how to make changes. And then this approach supports an evaluation system to actually measure the results. So what is the model? Here's a graphic on the left-hand side of this model. And this is a good time for me to jump in and say that, yes, because you participated in this webinar, you will get a copy of the presentation slides, and you'll get a copy of the worksheet that I use, which is, I'm going to explain it later in the webinar, but it's actually a simple word table that I use as a worksheet document to help think through the various strategies of different people at different parts of the process. But here's the phases. And if you look at on the left, you have the pre-contemplation phase, then contemplation, and then emotionally connected, then preparation, then action, then behavior either stops or continues. And this model can be used on two levels. It can be used on the micro level with individual people, and it can be used at the macro level with stakeholders and policymakers. And, as I was reflecting on this presentation, just in the last 24 hours in preparation for today's webinar, I was thinking there's probably even a middle level, which is what I might call the influencers over supporting a cause, like, and maybe you could call them interveners, if you will, that are between individual people and stakeholders and policymakers. But these interveners or influencers can actually help to support or advance the thinking of a social cause or the thinking around a social cause. And they also have a role because you want to get them on your bus as advancers, even if they're not decision makers or policy makers. And I'll explain that role as I go through this. And if and when I update this presentation ever, I'm going to add that role in the middle because there's a role for those interveners. But here's how it works, very simply. First of all, you want to define the social cause. What's the problem and what is the outcome that we're trying to achieve? Whether we're working with individual people or we're working with those influencers or interveners, or we're talking about stakeholders or policymakers, what do you want them to do? So what is that? So you have to define that. Then you look at the phases and the steps. You've got these 5 phases from pre-contemplation to action. What you want to do is you want to dissect them, and you want to think about the people as they go through the process and look at the motivators that help push people from one stage to the next. And I've done a bunch of research into these motivators, usually qualitative research through interviewing, and to, what are you thinking when you see this? What did you think back then? And what I found is, as you talk to different people, there's patterns of behavior across people that help to inform your knowledge about those influencers and motivators, and what kind of information do people need at what point in the process to help get them to the next step. You want to identify the education and the interventions that can be targeted to people in the various stages. You want to design those interventions, then create a campaign, and then implement and evaluate the results. It's kind of action planning 101. But let me talk about some examples of this. Now, one of my favorite examples, and if you look, Mothers Against Drunk Driving, 35 years ago, is kind of, I want to call them the prolific example of this. And if you look at their website, there's actually a section on their website that outlines their 35-year outcomes. But what's interesting is they started a new campaign in 2006 in response to the over 13,000 people who are being killed each year in drunk driving accidents. They put together a new campaign. And these are the things that the campaign does. There's 3 important steps. Law enforcement, requiring interlocking devices on cars, and supporting technology related to drunk driving. And what's interesting, and they show these outcomes, 7 years after the campaign started, 25 years have mandatory all-offender ignition laws, up from only 1 state. Although I did this presentation not too long ago and actually had a law enforcement official in the audience who said to me, yeah, but nobody's enforcing it, and they've got no teeth in it in some places. All 50 states now have some form of ignition interlock law, up from 45 again, but are they doing anything about it? And then advanced in-vehicle alcohol detection technology is no longer just a concept. It's now in its second phase of development. So some things have changed in the last 7 years. So how is your organization using the social cause marketing model? Are you using it at the macro level for marketing and advocacy? And are you using it at the micro level for programming and helping you design the kind of interventions that are going to get people to really accept and embrace some type of personal change? This is probably a good time for me to introduce this, but that framework that I labeled as the social cause marketing model, you will also find in psychology literature as the stages of change model, because it really does outline the rubric of people's personal choice to decide to change something that may or may not be important to them, and their ability to change something and sustain it has everything to do with their kind of walking through this process and accepting and embracing the change. So it is the stages of change model as much as it is the social cause marketing model. I'm going to talk about the macro approach first and get on my soapbox and do a little commercial about the importance of advocacy. And you can use this thinking to engage in stakeholder and legislative education and advocacy. You can also use it to help impact public policy through enacting legislation to change individual or group behavior. And many talk about the importance of doing this, but few organize themselves to do it well. So I'm going to talk first about the idea of advocacy and how you should be thinking about it. And then as I go through the model itself, I'm going to talk about how would you approach it from a micro level, and then how do you bring policymakers along with the thinking in the same spirit. And if you're interested in more information and resources on the standards for excellence, and in particular the advocacy standards that I'm going to talk about, you can find them either on the PANO website or at you could Google National Standards Institute, and you'll find it as well. So what are the standards for excellence? There are 6 guiding principles, 27 areas of focus, and 67 benchmarks. They fall into these broad categories. And you see the very last one is public awareness, education, and advocacy. And that's what I'm going to talk about today. If you're interested in the standards, you can go to the website and download them. They really are best practices for any nonprofit organization. But the areas of public awareness, engagement, and advocacy are not well understood. So I want to talk about them a little bit. Nonprofits should be educating and engaging the public in some way. They also should be working to advance the mission through public policy and recognize that it is okay to engage in lobbying and political activity as long as you know where the boundaries are. Now, you could, first of all, your board, if you're in a nonprofit organization, your board should have a board-approved advocacy policy and a public policy policy, believe it or not, to determine what your position is on issues that affect your constituency or cause. I'll give you an example. I know a lot of organizations in the long-term care world and in the intellectual disabilities world where there's pending federal and state legislation that will impact their reimbursement. You can get involved in those things, talk about it, determine what your organization's position is on some of those issues, and then work to influence the public policies that impact your mission fulfillment. In other words, if there's pending legislation that would hurt your clients, it's fine for you to sit down and talk to legislators. It's also fine for you to sit down and mount letter-writing campaigns for legislators to encourage people to get involved with and to educate policymakers about what their position should be on a particular issue. Now, you have to always remain nonpartisan in your activities, which means that you are not allowed to support or endorse specific political candidates or specific parties. And if you do any specific lobbying efforts, they have to be reported on your 990. The thing that you cannot do is get involved in what's called electioneering. So if you're a nonprofit leader, you should never have a particular political candidate sign in your front yard, for example, like you're promoting a particular candidate to be elected for governor or for another official position. But you should be looking at what are the things that our legislators should be thinking about, and following this process, looking at the legislative body in your particular area as a target audience for them understanding, accepting, and supporting your particular cause. So the model works for them as well as it might work for an individual if you want to change their particular behavior. So I'm going to talk about it at the micro level. You can aim education messages directly to consumers via public media or viral marketing. So here's how it works. We're going to talk about how do we apply it through these various stages. Stage 1 is the pre-contemplation stage. It's characterized by a complete lack of awareness of information about the subject. I have no idea. I know nothing about a particular topic. So I don't know what I don't know. So the question, so how do you get the person from pre-contemplation to contemplation? In this stage, the person is aware of the subject and is beginning to think about how the subject may relate to their personal circumstances, but they're not doing anything about it yet. And in order to move that person toward action, we have to get them into what's called the emotional connection phase, where the person is making the connection that this affects me in some way. And then once the emotional connection is made, an individual could begin to understand how their behavior change could improve their personal circumstances. So how do I get that person from saying, oh, I care about this, to I'm going to do something to prepare to change? And then the final stage is actually taking action, to actively pursue a behavior change to improve the personal circumstances. And then beyond that, there's also a process where you have to maintain the change once it's made to continue to reinforce that behavior so that it continues. But it's basically those 5 steps. So let's look at a couple of examples and talk about, what's the social change that these people are attempting and apply the model in various stages. So I'm going to talk about these 2 examples. I'm going to first talk about an organization called the Ophelia Project, which actually no longer exists, unfortunately. But it's more a case study in what not to do than what to do, believe it or not. Ophelia was a very early on, one of the trailblazers, actually, in the relational aggression and the bullying space. The organization was started very early to help members of a community recognize and address relational aggression and to create healthy social cultures. That's what they wanted to do, primarily in schools, to stop bullying for girls. That's how they started. And they used they really never figured out how to organize themselves well to really get into the space of legislative advocacy. And they also didn't figure out very well how to use the process of bringing people along and getting them to embrace the idea of change to help support the individual people. And here's where that concept of interveners or influencers makes a big difference, because Ophelia's approach was to go through schools, that they were really looking at creating safe places in schools so that bullying would cease to exist. And while you could, if you looked at their example from a policy perspective, they could have been going after legislation related to schools. They could have been going after rules and regulations in schools to stop bullying. And some of this has happened since the time that they were conceived. The other thing that has to happen where those interveners are concerned is you have to get the teachers and the administrators to embrace the idea of being catalysts for that change and being influencers of that change and helping to create the environment where bullying stops. So you can target bullying education at a child and try to get them, get the kids to work together to stop the bullying of a person. But if you don't have those administrators and teachers understanding their role in stopping the process as interveners, your social cause may not move along. So you have to bring people along at all three levels. But it's a good example of how that thinking could be fostered. Another example that I really like, that I wish I had the outcomes data, is Smoke-Free Philadelphia. There's actually an entire initiative in Philadelphia that I heard a speaker from the Robert Wood Johnson Foundation a couple of weeks ago talk about how the city of Philadelphia, just in the last couple of years, has made a huge impact on teenage and adult smoking through a three-pronged approach of policymakers and institutions and rules and regulations and access to smoking cessation programs. And one of the things that they did legislatively, and you could do this in Philadelphia but not in many other cities in the world, they actually passed a law creating a $2 a pack tax on cigarettes. And that made a big difference in the city of Philadelphia, believe it or not. They also did things like work with health insurance programs, health insurance companies, to actually cover smoking cessation programs in their benefit design and give people access to those smoking cessation programs much more easily and quickly than they were doing. They also put together a very widespread campaign to get people in that emotional connection phase. I'm actually going to show one of the, my links work well on my webinar, I'll actually show one of the videos, one of their commercials that is very powerful in terms of, oh God, I don't want that to be me. But they've done it well in terms of working on various levels and orchestrating that campaign, that the smoking rates in the city of Philadelphia, the graph was astounding. Just in the last 5 or 6 years has gone down like a rock. So those kinds of things can happen if you have a concerted effort. So what are the steps in the process? Here's how it works. First of all, you want to identify the characteristics of the individuals, determine the motivators, develop activities to move people through the steps, match your outreach and education activities to where people are in those steps, and evaluate your efforts and adjust accordingly. Now, I do have to say, with social media and technology, that it is very possible very quickly to jump people through all 5 stages where they go, I have to do this or I have to do something. And a good example of that many people are aware of in recent years was the ALS Ice Bucket Challenge campaign. That campaign actually raised awareness of ALS and raised millions and millions of dollars for their association. The question for them is how to sustain it. And did that activity make any meaningful change in local areas that could be sustained over time? Those are questions that are kind of out there. But here's how it works. First step, identify the characteristics of people at each stage of the model. Be as specific as possible as how they act, what they think, what they do. If you don't know how people are thinking in the pre-contemplation phase, how they were thinking in the contemplation phase, what you want to do is go back and interview people that have actually achieved some successful outcome about what they were thinking and how they felt as they walked through the process. Now, think about, let's use quitting smoking, for example. You could, and people, this could be done in Philadelphia, really interviewing people who quit smoking. What were you thinking about quitting smoking before you decided to think about quitting smoking? Okay? How long did you smoke? What was important to you? What were you thinking, and what prompted you to say, oh, quitting smoking might be an important thing? What actually happened that you had some belief that quitting smoking might be something that you should be doing for yourself? What were you thinking? What information did you have at that point that helped prompt you to take that next step? And basically dissect what people's experience is across the various steps of the process. Now, I have to tell you, you don't have to interview hundreds of people. You only have to interview a half a dozen people. 6. There's a rule of 6s that works sort of miraculously in these kind of situations. Because what happens in that kind of research is that you'll start to hear the same themes over and over again. Even though people's stories are different and their experiences are different, you want to be looking at, say you interview 6 to 10 people, what were the similar characteristics about what those people said and thought? The other thing you need to think about is if people are in different life stages or in different demographic, if they have different demographic profiles, you may have differences of opinion across those demographic characteristics because of the nature of their characteristics. And I'll give you an example. Someone of Hispanic descent may have a completely different way of thinking than persons that are either African American or Caucasian. And a person who's 50 might have a different experience than a person who's 20. So you want to be thinking about, if you're interviewing people that are, you want to think about who you're interviewing and make sure that you have some diversity there, where you're looking at, is there a difference between, how some people feel about this and others based on those demographic characteristics. And I'm going to come back to that because, again, you don't have to interview a cast of thousands. You can interview a handful in each group. And it gives you enough information that you can test it later in a survey to measure your outcomes. But this is where you start. Your second step is, thinking about the pre-contemplation phase. How do we get people from, I don't know anything about this, to now I'm thinking about it? How do we get the attention of people who have no knowledge of our subject matter? What the techniques that you see people using are stories and magnitude and statistics. Those are getting people's attention. Like, for example, autism, 1 in 68 is now the statistic that we see. So those statistics now get people's attention. What kind of marketing interventions might we do at this pre-contemplation phase? We might do education and outreach programs. We might tell compelling stories or use videos or commercials to get people's attention, get them to start thinking about it. And then what you want to do is determine the motivators that prompt movement to the next phase. It can include information, incentives, or barrier elimination activities. I mentioned the Quit Smoking Philly campaign. One of the barriers to getting people in smoking cessation programs was that their insurance company didn't cover the cost of it. So, if I'm a smoker, I'm not going to spend $100, whatever it is, to get into a smoking cessation program if I don't feel that I have the money. So if you eliminate that barrier, it makes it more readily accessible for people to get involved in it. So it could include all of those things. Now, once we've gotten their attention, the question is, how do we encourage people to think more deeply about the issue and to think about how it relates to them? You can start to give them information about how to take action. You can encourage them. You can get other people involved with them, sometimes outreach workers or mentors. Again, barrier elimination activities help in this area. And the specific content of what you might put in those can be developed based on what the people that you interview tell you about what motivates them. And as I mentioned earlier, I've done a number of those kinds of interviews, and people will tell you, I need to know this. If I'm contemplating making this decision, this is what I need to know. I need to know where to get help. I need to know who I talk to. I need to know what might be the downside of getting involved in your program. Some helpful interventions in the contemplation phase that I see some people doing are navigation services. They offer this, how do you help get through this maze of services? And I'll give you an example of that. I'm familiar with an organization in Erie, Pennsylvania called HVA Senior Services. It's an alliance of long-term care facilities. But they recently hired a navigator person, and this is a free service that's offered to the community to help people really think through what their options are for senior living and long-term care. A lot of people are afraid of nursing homes. They don't want to live in nursing homes, and sometimes they won't even explore the alternative to a nursing home because they're afraid of the conversation, when they could easily be able to live in their home and age in place with the appropriate home care supports, but they're not having the conversation because they're afraid somebody's going to want to put them in a nursing home. So a navigation service can help with that and help provide the appropriate resources and, eventually help people accept the right kinds of, make the right kinds of decisions and accept the right kind of support. And then continue education and engagement to help recognize that this thing is not so scary if I do it or make the decision to do it. Step 3, develop specific activities designed to intentionally move individuals through the various stages to action. And here's where you have to think about, there's a new term for it called person-centered design. Because the information and support that an individual needs in the preparation phase is in many cases different than they need in the pre-contemplation phase. So if you're just creating awareness, that's a different message than if you're trying to prompt a person to action. So have different materials, have different stories, have different interventions for people at that phase. It'll make all the difference in the world if you customize it to what people's information needs are. And you think about it. And then there's the emotional connection phase, which is how to get people to understand that something could or should apply to them. And will this particular item make a difference in their world? And I'm trying to click on this, and it is not working. When you get the link to this webinar, I encourage you to look at this particular video. Let me see if I can find it, and then share my desktop with you. I apologize, but this is not working. Sometimes technology is great, except when it doesn't work. And I'm having trouble having trouble even. No, it's not going to let me get to it. Check out that video when you have the ability to, when you get the link to this for the webinar, and get the slides. Step 4 is to match your outreach and education activities to where people are, including asking questions to assess which stage an individual is in selecting the appropriate activities and the content that they might have at that phase. And then think about the emotional connection phase. Stories, videos, compelling images make all the difference in the world to people. The preparation phase is how do we make it easy for people to learn about or how to take action. It is so easy. You know, some things make it easy that you could take action right there. Other things make it way more difficult to take action on a particular issue or event. You want to make it possible so that it's simple. And then marketing interventions could include brochures, pamphlets, tear off phone numbers. One of my favorite calls to action is in restrooms where they have posters on domestic abuse and they have telephone numbers as tear-offs at the bottom, on the bottom of those sheets. I've seen them in a number of places. Those are good calls to action. And then the perception that the pain of the present is greater than the pain of the change is often the motivator to action. And then peer pressure. Peer pressure also works. This is how policy change makes a difference. And I mentioned earlier that I heard this presenter from Robert Wood Johnson Foundation talk about the story in Philadelphia. And what was interesting about that, there was in the program that I was in, there was kind of a debate about, well, do you go after individual people or do you try to change policy? And they actually have evidence that if you change the policy, hanging around people that have different behaviors. So if you're a smoker and you're hanging around non-smokers, you're going to be more likely to quit smoking. So that peer pressure of hanging around people who act in a certain way makes a big difference. And then evaluate your efforts and adjust accordingly. It's important to measure and evaluate the outcomes and impacts of your efforts individually and collectively, and continue what is working and what's not working, and change what is not working. And many times people can evaluate, even though it's costly to set this up this way. But if you're going to put effort into a campaign and you're working in a community, you can do a pre- and post-test, doing a survey. You do a pre-test of people's awareness about a particular issue before you start a campaign, and then you test people's awareness of or knowledge of that topic 6 months down the road, 9 months down the road. And then how might we measure attitude during the action phase? Well, one good way to measure the attitude shift as people take action is, did they in fact take action? How many people of those that you created this education campaign for actually signed up in the end and said, I'm going to try to quit, and went to your smoking cessation campaign, for example? I have some other examples that you'll see in the handout of ways to measure awareness. If you're doing education programs, you can actually do an evaluation form at the end of the program. Many do to rate the speaker, but you can rate the knowledge that you gained. You could actually rate the information that you get. How useful is it that you might do something about it? You can actually measure how likely are people to take action based on the knowledge that they got. And the intent to change behavior is actually an outcome, where satisfaction with a particular program is only an output. But you can apply these strategies to individuals in a program. You can also apply these strategies to your legislative delegation about their acceptance of ideas related to your cause. So how do you do this for yourself? You can look at the social cause you're trying to affect, look at the action that you're trying to achieve, and you fill out this matrix. And I'll send you a copy of this as well. You look at, and it's this simple. You look at the characteristics of the people who are in this phase. You talk to folks about what's the motivation of the prompt to the next phase, and what are the intervention strategies that we can do to help people move to that phase. And then you develop your marketing campaign around those items in that third column. So once you've determined the characteristics and how to measure the attitudes, you develop a survey to measure results, collect baseline data to validate the characteristics, okay, that you learned in the interviews. You implement those specific targeted interventions at the various segments. You develop and implement your campaign, and then you measure the results. And then as you think about it, you never want to doubt that a committed citizen can change the world, because indeed it's the only thing that ever can. So with that, I will stop the recording and take any questions that anyone has.